Gentlemen over 60, let me ask you a very direct question. How many times have you thought that your intimate life has come to an end? That those moments of intimacy and pleasure are just memories of the past? If this reality bothers you, stay with me because I'm going to reveal something that could completely change your perspective. I am Dr. Emily Carter, a urologist with over 15 years of experience dedicated exclusively to men's health. Throughout my career, I have seen men regain their confidence and vitality in ways they never imagined possible. Today, I'm going to reveal 3 specific points on your own body that, when stimulated correctly, can reignite natural and vigorous erections even after the age of 60. Stay with me because this is not an empty promise. It is applied science that I have seen work repeatedly in my clinical practice. In just 21 days of consistent application, you can experience significant changes in the quality of your erections. The truth is that your body has a complex neural network that connects different points to erectile function. Many men are unaware that there are specific nerve centers that, when activated through correct pressure and movement, can stimulate penile blood flow naturally. I'm referring to the parasympathetic nervous system, responsible for relaxation and vasodilation functions. When this system is properly activated, it sends direct signals to the corpora cavernosa of the penis, promoting the blood filling necessary for a firm erection. The interesting thing is that these neural points remain functional even with advancing age. What happens is that we lose our natural connection with them due to stress, a sedentary lifestyle, and hormonal changes. But the good news is that this connection can be reestablished through specific stimulation techniques. Research in vascular neurology shows that adequate pressure on reflex points can increase blood flow in the pelvic region by up to 40%. This happens because we activate pressure receptors that communicate directly with the vascular center of the brain. What few people know is that there is direct communication between certain points on the body and the hypothalamus, the region of the brain responsible for the release of sex hormones. Studies at Harvard University have shown that controlled stimulation of reflex points can raise free testosterone levels by up to 23% in men over 55. In addition, activating these points promotes the release of nitric oxide, the molecule responsible for relaxing the blood vessels in the penis. This substance is produced naturally by our bodies, but its production decreases with age. Correct stimulation of the points I am going to teach you can increase endogenous nitric oxide production by up to 35%. The 3 points I am about to reveal are based on ancient knowledge of traditional Chinese medicine, validated by modern neurophysiology studies. The first point is located in the perineum region, between the anus and the base of the scrotum. This is the Huiyin point in acupuncture, known as the center of male sexual energy. When properly stimulated, it directly activates the pudendal nerve, responsible for genital sensations and blood flow. What makes this point special is its direct connection to the prostatic plexus, a network of nerves that controls not only erectile function, but also sexual sensitivity and pleasure. Modern medicine has discovered that this point corresponds exactly to the location of the bulbospongiosus muscle, which is essential for maintaining erection and ejaculation strength. The second point is located on the inside of the wrist, approximately 3 fingers below the crease of the wrist, on the side of the little finger. This point, called shenmen, connects directly to the cardiovascular system and helps reduce performance anxiety, one of the greatest enemies of natural erection. Anxiety releases cortisol, a hormone that inhibits testosterone production and drastically reduces penile blood flow. Stimulation of this point activates the parasympathetic nervous system, reducing cortisol levels by up to 42%, according to studies by the Mayo Clinic. The third point is located on the back of the ankle, in the depression between the Achilles tendon and the ankle bone. This point, known as Taikshi, stimulates the energy of the kidneys, an organ that is fundamental for the production of sex hormones according to traditional medicine, and which modern science confirms through the production of nitric oxide, a substance essential for penile vasodilation. Interestingly, this point is directly connected to the posterior tibial nerve, which in turn communicates with the pudendal nerve through the spinal cord. This connection allows stimulation at the ankle to send direct signals to the genital region. Now I will teach you exactly how to stimulate each of these points for maximum results. First, the perineum point. Sit comfortably in a chair with your feet flat on the floor. Make sure your hands are clean and your nails are trimmed. Locate the exact point by gently pressing the area between the anus and the base of the scrotum until you find a small depression. You will know you have found the correct point when you feel a slight sensitivity different from the surrounding areas. With your middle finger, apply firm but comfortable pressure to this point. The pressure should be equivalent to placing a finger on a scale and marking approximately 2 kilograms. Make circular movements clockwise for 30 seconds, rest for 10 seconds, and repeat for another 30 seconds. While applying pressure, breathe deeply and try to completely relax your pelvic muscles. The pressure should be firm enough to feel a slight tingling sensation radiating to the penis, but never painful. If you feel pain, reduce the pressure immediately. Practice the stimulation twice a day, preferably in the morning when you wake up and at night before bed. Consistency is key to reprogramming neural connections. Second, the pulse point. Wash your hands thoroughly before starting. Sit comfortably and extend your left arm with your palm facing up. Locate the point 3 fingers below the crease of your wrist, in line with your little finger. You should feel a small depression between the tendons. With the thumb of your right hand, apply constant pressure to this point for 60 seconds. The pressure should be moderate, as if you were trying to feel your pulse in that area. While applying pressure, focus on your breathing, inhaling deeply through your nose and exhaling slowly through your mouth. Breathe deeply while maintaining pressure, visualizing a feeling of calm and relaxation spreading throughout your body. Repeat on your right wrist using the same technique. This exercise should be done 3 times a day, especially in moments of anxiety or before intimate activities. Regular practice can significantly reduce performance anxiety in a matter of days. Third, the ankle point. Sit comfortably and raise one leg, resting your ankle on the opposite knee. This position allows easy access to the point without muscle tension. Locate the depression behind the ankle bone, between the Achilles tendon and the ankle bone. The correct point is approximately at the height of the ankle bone, in the deepest depression you can find. With your thumb, apply firm pressure to this point while making small circular movements in a clockwise direction. The pressure should be firm, but never painful. Hold for 45 seconds on each foot, breathing deeply throughout the process. The sensation should be one of deep relief, as if tension is being released from the lower back and pelvic region. Practice this exercise once a day, preferably in the late afternoon, when cortisol levels naturally begin to decline. To enhance the results, combine this exercise with a warm bath before bed. The results begin to appear gradually, but in a very specific way. In the first week, you will likely notice a feeling of greater overall relaxation and reduced performance-related anxiety. Many men also report more restful sleep and a feeling of greater energy during the day. This is a sign that the parasympathetic nervous system is being activated correctly. In the second week, the changes become more evident in the genital region. Many men report more intense sensations in the genital region, greater ease in achieving morning erections, and a more present libido throughout the day. It is also common to notice firmer erections during sleep, especially in the REM phase. From the third week onwards, the quality of erections tends to improve significantly with greater firmness, duration, and ease of initiation. Sensitivity may also increase, providing more intense sensations during sexual intercourse. It is important to understand that this process is cumulative, and each body responds at its own pace. The more consistent you are with the practice, the better and longer lasting the results will be. Some of my patients report improvements that last for months after establishing the correct routine, with some managing to reduce or even eliminate the need for erectile dysfunction medications, always under medical supervision. The key is regularity and proper technique. Remember that you are reconnecting neural circuits that may have been dormant for years. Patience and consistency are essential to fully reactivate these natural pathways in your body. After the first 30 days of regular practice, many men are able to maintain the benefits by practicing only 3 times a week. It is important to understand that these techniques are complementary and do not replace medical care when necessary. If you have diabetes, high blood pressure, heart problems, or take blood pressure medication, talk to your doctor before starting any new routine. Although these techniques are natural and safe for most people, specific medical conditions may require adaptations or contraindicate the practice. Never stop taking prescribed medications without medical advice. If you feel any discomfort during practice, stop immediately and reevaluate the technique. Men with a history of prostate problems should pay special attention when stimulating the perineum. I want you to understand something fundamental. Your body at age 60 still has all the physiological capacity necessary for a full and satisfying sex life. What is often lacking is just the right knowledge to activate the natural mechanisms that have always been there. These techniques I have just taught you represent thousands of years of wisdom about the human body, now validated by modern science. You don't have to accept that your intimate life has come to an end. You don't have to resign yourself to a reality that can be transformed with dedication and proper knowledge. Your body is an extraordinary machine, capable of regenerating and revitalizing itself at any age, as long as you provide it with the right tools. Age may bring changes, but it doesn't have to bring permanent limitations when you know how to work with your body, not against it. If this information makes sense to you and you are already thinking about how to incorporate these techniques into your routine, subscribe to the channel for more content on men's health after 60. Share this video with a friend who could also benefit from this information. See you next time. This is Dr. Emily Carter.